All right, good afternoon again. My opponent opened up a door for me. One of the things he was talking about is that according to the medical ethics is that the objective of doctors is that they should be preserving life. Well, I have, well, first I'd like to point out, make a point. There are survey results that say that the medical field supports euthanasia. Celia Milne writes in What If Euthanasia Became Legal Across Canada? She writes that despite any support, objections, or fence setting concerning the legalization of euthanasia in Canada, the practice is already occurring. The Federation of Medical Specialists in Quebec conducted a survey of members in 2009 that revealed more respondents said that practice is often or sometimes employed versus rarely employed. Sometimes employed 52% of the time versus rarely employed in 29% of the time. It found that 75% of medical specialists in the province would certainly or probably feel favorably towards euthanasia if the framework surrounding the legislation were clearly defined. Passage of a bill legalizing euthanasia by the House of Commons would receive the support of 76% of specialists, according to survey results. Pamela Frank writes in an article titled State Healthy Physicians and Assessment of the Louisiana Natural Death Act. She writes that according to a survey made by Davidson, Hackler, Carradine, and McCord in 1989, approximately 1,293 physicians from Arkansas through questionnaires to evaluate their attitudes and experiences with advance directive. Of the 790 physicians who responded, approximately 80% expressed a positive attitude, with less than 2% expressing a negative attitude towards the document. About 56% of the physicians had actually worked with advanced directives, and 83.5% of these doctors felt that their attitudes had become more positive due to their experience with the document. Also, there has been a claim being thrown around that the doctor-patient trust will decrease. Well, survey results say that patient and doctor trust can actually increase. In a study and David Smith writes in an article titled "A Psychiatric Defense in Aid in Dying." He writes that in a study of patients' views about physician participation in assisted suicide, 91% of 228 persons surveyed found that a physician who assisted in patient suicide would be as trustworthy as a physician who did not participate to take care of critically ill people. 85% felt a physician who participated in assisted suicide would be able to effectively offer emotional support to surviving family members. Most telling of all was the statistic that 95% would continue to see their doctor even if they knew he or she had assisted people wanting to commit suicide. Thank you.